Thank you very much for having me along today. So I'm going to talk a little bit about the Determined study. It was my pleasure about 2 years ago to come and talk about the project just as it was kicking off. And I think it's fair to say, looking back now, I presented quite a kind of ideal version of how this project was going to run. It's been a little bit rockier than that with everything that's gone on over the past couple of years. So the project is a 5-year longitudinal study that's funded by the Economic Social Research Council and the NIHR. And we are examining the determinants of quality of life, care and costs and consequences of inequalities in people with dementia and their carers. So for obvious reasons, we use the acronym DETERMINED to refer to this project. So as Nadji said, it sits within Brighton and Sussex Medical School, and it's led by Professor Subi Banerjee, who you heard from just recently, and I am the project manager of this. So what I'm going to do today is just talk to you a little bit about what happened with Determined and where we are now, and present just very briefly some of the insights that we were able to gather from some of the preliminary data. But the project is very much still ongoing and recruiting. So for those that weren't here 2 years ago, just a bit of a recap. Determined is designed to investigate these inequalities and inequities. So what we know is that people can live very well and for a very long time with dementia, but we know that certain factors or determinants can impact on the care pathway and consequently on their quality of life whilst living with dementia. This can include things such as where they live, if they're in a rural area as opposed to an urban area, things like ethnicity, race, culture, sexual orientation, age. So these can all have an impact on how somebody experiences the condition and can either lead to kind of detrimental outcomes in terms of their quality of life and well-being, or can enhance their quality of life and well-being during this care pathway. So what we're looking at doing is understanding which populations, communities or people may experience these inequalities and inequities and what we can do to improve them, to hopefully present a kind of ideal care pathway for everybody to be able to live well with the condition post-diagnosis. It's a big project. It's running all throughout England. It's based in the medical school, but we are working and with Sussex University, but we're also working with colleagues within London, South London, and also in Newcastle and in Cambridge and in York as well, alongside the Alzheimer's Society, who will be engaging with throughout the project to translate some of these academic findings into policy or advocate for changes in practice and things like that. We're looking at recruiting. We began in 2019, just before the pandemic, at the sort of latter part of 2019, and our aim was to recruit 900 people who had received a diagnosis of dementia within those 6 months of consenting onto the study. And the aim was to recruit these across 3 main sites, in the south, in London, and then in the north. So 300 in each site. We were taking on anybody, or we are taking on anybody with any type of dementia, as long as it's been clinically diagnosed within 6 months. But we are also looking to oversample certain populations, as we know that these can face particular challenges in the post-diagnostic care pathway. So within Brighton, we're looking at oversampling people who identify as LGBTQ+. Within South London, or London more generally, we're looking at over-recruiting Black, Caribbean and South Asian populations. And within Newcastle, we're looking at over-recruiting or oversampling white working class populations. So everything was going well. We got up to March. We had just shy of about 300 people recruited onto our study. The plan was to recruit 900 over 1 year, over the first year, and then each year to follow them up, asking them similar questions about their kind of cognitive levels, services used, general sense of well-being, and do that once a year for the following 3 years. So at that point, we'd map their care journey over 3 years and have 4 time points of data. So we had around 260, 270 people. And then in March, obviously, COVID happened and the memory services shut down, no longer diagnosing, and a number of our research team went to work on the front line for the NHS. So Determined pretty much ground to a halt. We did have, as I said, we did have some baseline data for 260 people with dementia and also their carers that we could start to use to understand the impacts potential impact of the pandemic on these people. And so we were able to follow up. We're in the fortunate position of having this baseline data, which many studies didn't have that were conducted throughout the COVID study. We were able to follow up these people and collect an additional data point, which we did with funding from the UKRI. So we did telephone interviews, delivered questionnaires over telephone or virtual interviews with people with dementia and their carers during this time point. So this was conducted around about June, July, August of 2020. So just as we were coming out of the first lockdown, before going into another one, kind of mini lockdown around the November period. So this was when the data was collected. And we managed to recruit 93 people with dementia to take part in this aspect and 113 carers. So very briefly, just some of the data that we're now analysing and what we're kind of finding. So we've looked at quality of life and how that has been impacted by the COVID lockdown, and found that generally at a kind of group level, people with dementia's quality of life has remained fairly stable, and that's against what we expected. However, carers have found it particularly challenging time during this period, and particularly those carers living in, and this harks back to Darina's presentation, particularly those carers living in more socioeconomically deprived areas where services, formal dementia services, completely shut down, and also those carers who were looking after people with dementia who had greater cognitive decline. So these carers really suffered in terms of their quality of life during the pandemic. We also were able to have a little bit at how people experience loneliness during this time as well, and some of the pathways or predictors of loneliness in people with dementia and their carers. Well, and again, some quite interesting findings in terms of non-spousal co-resident carers kind of moving in to live with people with dementia. This was more likely to predict higher levels of loneliness in carers during the pandemic, and this was particularly exacerbated if they were supporting people with dementia who had greater levels of cognitive deterioration. Interestingly, we didn't find that spousal co-resident carers reported these kind of increases in high levels of loneliness, and this could be something to do with the fact that they perceived this was something that they should take on as part of a kind of couplehood model, you know, the caring, so, and developed coping strategies to help mitigate some of these challenges. For people with dementia, having a non-spousal co-resident carer moving in with them actually supported their sense of well-being or predicted decreases in their loneliness. And we sort of posit that this is potentially due to the opportunity to increase and develop their relationship with their family members as they move in. And also we found that carers who had high levels, reported using high levels of formal activities during the pandemic, so carer support groups and things like that, reported higher levels of loneliness once these shut down during the pandemic. Again, this is quite interesting findings. Our qualitative work that we've managed to conduct during this period has also looked at how people have kind of managed the pandemic itself. And it's pointed to certainly some elements of resilience within people with dementia. There was certainly potential for people to face this shrinking world effect as reducing social interactions, reduction in formal services. But we also know that people with dementia have managed to develop their own coping strategies, whether this is kind of to reframe the situation, you know, carry on and keep going, either engage in new activities and learn new hobbies and things like that. And some in our cohort also were able to engage with kind of ICT technology, information communication technology and virtual platforms to keep in touch with other people and to maintain some of these social networks. So I must kind of put the caveat here that this is only from our cohort of people. What we know is that certain people with dementia really did struggle, and think potentially we haven't picked up on these people within our cohort, maybe because they were having such a difficult time. It was difficult for them to engage with research. The methods we used in terms of telephone interviews and things like that may also have excluded these people as well. But some of the key messages that's been coming out of our research is actually potentially people with dementia haven't, certainly within our data, people with dementia haven't experienced some of the issues that we were expecting them to. And part of this talks to their role as developing coping mechanisms that they're able to draw on, and a kind of sense of resilience to support them during this time. But what our data really does speak to is the difficulties that carers have had during this period, and a lot of the effort that they've put in to support the quality of life of people with dementia, and the loneliness of people with dementia, or stop them from becoming lonely, has actually then had a detrimental impact on their own quality of life and their own sense of loneliness as well. So what we see here is that, like, the need to urgently bring back these kind of post-diagnostic psychosocial support groups for carers, particularly those who have had these services removed and who are living in more deprived areas, and to think about urgently kind of targeting these areas to bring them back. Working with our Time for Dementia colleagues, we've also produced some guidance as a joint collaboration between the ARC and Time for Dementia, in terms of some of the key findings from our research and support for practitioners who are engaging post-pandemic with people with dementia, to help them sort of navigate what is now the new normal, I suppose. And if people are interested, then this is available. Please feel free to contact me. In terms of the project itself, well, we got back up and running again in a late 2020, I'm getting my dates, but yeah, early sort of 2022. And we've got now 550 people recruited onto the cohort. We were fortunate to receive some additional funding from the Economic Social Research Council. So the project is now running until the end of 2024. And we have been tasked with recruiting 1,000 people with dementia, as opposed to the 900 that we were originally going to do. As I said, the recruitment is still ongoing, and we'll be doing this until the end of August 2022. So we're very much in the kind of sprint stages at the end now, to get these final 450 people with dementia onto our team, onto our cohort. In order to do that, we have taken on board additional sites, identified participants across the Sussex region, including Kent and Surrey, within South London, and also within Newcastle and Gateshead as well. What we do have is data, as I was saying, throughout the pandemic, that we can continue to track people to answer these important questions about how people navigated the care pathway, having received the diagnosis pre-pandemic, and how they navigate it then moving through into the new normal. And we can compare this cohort with people that we are now recruiting who are diagnosed post-COVID, and to actually understand in some real detail, through both quantitative and qualitative measures, the impact, the long-term impact of COVID for people with dementia and their quality of life. And as I say, we'll be working with the Alzheimer's Society as we start to generate the data from this study to influence policy and practice moving forward within the new normal care pathway. So that's everything for me. We are on all the social medias, so please get in touch. All of our work that we produce is published on our website, with links to the academic journals. Yeah, and if you feel that you can help with recruitment, as I was saying, we're going to the end of August. If you are diagnosing people with dementia, or regularly see people with dementia who have been recently diagnosed within 6 months, please get in touch. And we can try and bring them on board with the study.